Hi, I'm Melissa Fuller with Shape of the City. We are at Matt Talbot Kitchen Outreach, and I am with Executive Director Suzanne Blue, and I'm with Clarence as well, and we're going to talk about all things Matt Talbot, get to know what's going on here, especially those things you may not know about Matt Talbot. So, Suzanne, give us a good overview of what Matt Talbot is. How long have you guys been around, and what is really your mission in the Lincoln community?
We were founded in 1992, and feeding the hungry is at the core of what we do, but really it is so much broader than feeding in the broadest sense. So of course we do the daily meals, and that's how we started, but we have housing programs, we have skill building programs, we provide street outreach and basic needs for our homeless guests. Many of our guests are the working poor, so we do a lot of short-term interventions to assist them in overcoming barriers. Just providing a very welcoming presence, a very accepting environment for our homeless guests and really anyone. We coordinate one of the largest volunteer programs in Lincoln. It's really wonderful that our organization was founded by volunteers who got this whole thing going for us, and now in our 26th year, it's just amazing. I mean, we have probably about 3,000 volunteers annually coming through, and they provide the majority of the meals that we're serving.
How can people, if they're viewing, how can they get involved, or how, either through volunteering or maybe they know someone who could use some of these services?
We get a lot of requests for volunteerism. You can do that, via coming in directly. We have access through our website, making a phone call. A lot of it is word of mouth, in terms of our clients and guests accessing services. I mean, we've been around a long time. We are very collaborative. We work with many different organizations, and the Lincoln Homeless Coalition is a primary resource. So we get a lot of referrals. We really don't have to worry about people not knowing where we're at and what we're doing to help.
Well, let's just really quickly tell people, where are you located in the city?
We're at 2121 North 27th Street. We're just a little bit north of the Lincoln Water System, and we're on a bike path, and we're right on a bus route, and so we feel like it was a very convenient spot. We're in an area where the majority of our clients can access us. We looked at zip code, and so that we were accessible to people who needed our services and had limited access to transportation and other things like that.
So Clarence, can you tell us a little bit about the substance use part of Matt Talbot?
Yes, the substance use program I've been overseeing for about 6 years now. Largely we provide numerous substance use evaluations. Substance use evaluation is the starting point where somebody is going to get treatment. You're not going to be able to get into a substance treatment if you don't have a substance use evaluation. And we provide a majority of those to no cost to the individuals we serve, depending on their housing situation and their employment situation. We also offer education classes for individuals that have maybe a first-time DUI or an MIP. Maybe they've failed a UA at work and they're mandated to take a substance use class. And we provide both an 8 and a 15-hour education class for them. The CARE program, which we call it, it's counseling, advocacy, referral, and education and evaluation care. We also oversee the transitional housing that Matt Talbot provides for individuals that are homeless and struggling with addiction. So we provide a stable, sober environment for individuals who are either coming out of treatment or have a prior substance use issue that is homeless. We give them that stable environment to work on their issues for up to 2 years with very minimal out-of-pocket money from them. And we work on different areas like financing, recovery, debt, family. We work on a lot of different issues, finding them employment and allowing them to get their feet under them so they can move to independent living. We also offer a pre-treatment class or group that is pre-treatment / interim treatment for individuals that have received a substance use evaluation. It could either be from ourselves or from another agency, and now they're waiting to get into residential treatment. And that can be a wait. It could be anywhere from 2 to 4 weeks. And that person's standing there and going, well, what do I do until I get into treatment? Well, they can come to us, and we will support them. We will guide them. We'll do a little education, and really keep them motivated until they get into treatment. So they're not just standing around or sitting around or falling off the grid, because treatment centers will then call me and say, hey, have you seen Joe Blow? And we're like, no, we haven't. But if we can get them plugged into our pre-treatment, we can keep them engaged and then get them into treatment.
Again, is this something that is open to anybody in the community?
Yes. If the pre-treatment specifically is for individuals that are awaiting to get into residential treatment, so either a long-term or a short-term residential treatment, and we'll take it from there.
And then just like some of the other programs, do you have community partners in programs like this that you work with?
Yes, we work with community corrections, we work with probation, adult probation, we work with a number of different treatment facilities, residential and outpatient treatment facilities, and individual private providers.
So do you guys have any final thoughts, anything else that you would like to share?
We provide services to individuals not only in Lincoln, but surrounding areas. So you don't have to be from living right next door. You can be from out of town or out of the Lancaster County area and still get services at Matt Talbot, where our doors are open to anybody.
And I just want to take a minute to thank the entire Lincoln community. They've been so generous and gracious to us with the volunteerism and the support, the financial support, the local foundations. Community Health Endowment is one, for instance, that all of our health initiatives, even from the early days to really help us by bringing on a dietitian to improve the nutrition of our meals and supporting our relocation and putting in a very wonderful kitchen for us, helping with that, to the new, substance use expansion and reaching out to people while they're on that waiting list for treatment. We've been very blessed, and we've had great community support, and we're grateful for that.
Well, I think we would also like to thank you guys. You guys are on the front line for everything that's happening, and you guys have a bright future, and I look forward to seeing everything going on here.
Thank you.
Thank you.
Drowning can happen in an instant, anywhere there's water. Put down your phone and supervise your child. It could save their life. Make sure that your kids are always in view, and they will have a great summer.
Hello, I'm Melissa Fuller with Shape of the City. I am at Health 360. I am with Dr. Erica Peterson and Karina Ruiz Vargas. And we're going to talk about breastfeeding and how that's being integrated into a number of Bluestem Health organizations or entities. So, hi Erica. Hi Karina. Let's talk a little bit about how Bluestem Health has gotten involved with breastfeeding. You give us a little lead in?
Sure. So here at Bluestem, we'd always been interested in supporting breastfeeding moms and families. And recently we applied for a grant that gave us some extra funding to try and take what we were doing to support our families to the next level in conjunction with some community partners. And so we've just been working as a team and working with our community partners to provide even better support and services for breastfeeding moms and families here at Bluestem.
Perfect. Can you talk about what some of those programs are looking like?
Sure. As an initial step, we felt like in order to provide the best care, we really needed to define what that was. And so as an organization, we met as a team in conjunction with our partners through Partnership for Healthy Lincoln and Workwell, and came up with sort of our vision for what we should do as an organization to support breastfeeding moms who are employed here at Bluestem, both internally, but also for our clients and our patients when they come here for care. So we actually wrote a policy, or wrote a procedure, which kind of outlines what we aim to do to support both our staff and our families when they come to Bluestem.
And you received a grant, correct?
We did. So we were really excited because it was a fairly competitive grant that it was put out through NACHO, which is the National Association of County and City Health Officials. And they had over 30 applicants from community health centers across the country. And we were really lucky to be one of 4 centers that they selected to support to try and expand what we offer as a community health center to patients in the Lincoln community.
So since the grant has gone through, what have you guys started to do?
Yeah.
I can kind of talk a little bit about what I do here at Health 360. So Dr. Peterson and other providers are able to send me some requests to help some moms that are struggling with breastfeeding, or some moms that are pregnant, so I can give them information about breastfeeding ahead of time. So I am a certified lactation counselor. I'm able to help moms. Just with the basics, but we can always send them to places like MilkWorks if they need anything more than the basics. Sometimes it is a little bit more difficult to get out there, so I am here as a resource. If moms need me, mostly I work with latch and supply. So
Why is it so important to give support, I guess? Where is this need coming from?
Sure.
the need for support has come up because it used to be something that we used to do, but then once people started thinking that formula was the only way to go, we had to kind of backtrack and say, well, the natural thing would be the priority, not that people can't give their kids formula, but just to support moms that do want to breastfeed, but can't figure it out because of latch, or can't figure it out because there's another issue that has come up that sometimes is very simple to solve, but moms just don't know where to go to do that. So we decided to be that resource for moms.
And what we found, I think, as a community, with some of the efforts that our community partners had already made, is that as a community, a lot of moms start breastfeeding in the hospital, and then you're kind of on your own. So those resources in terms of planning and support when things get hard become even more critical. And what we found is a lot of our clients find it hard to access some of the resources that have already been developed in the community. So a lot of what we've done with this grant is work with them to try and bring some of that great work that our community partners have already been doing here to our patients at Bluestem by holding some educational activities. We plan to also hold some pump clinics where they can come here to get their pumps so they don't have to drive across town, those kind of things, just to try and bring some of those wonderful resources we have here as Lincoln to the people here at Bluestem that are coming for care.
And what has the feedback been, even within your employees?
I think that overall people are excited that that we are providing them with tools so that they can better help families that are coming to Bluestem. I think all of us, we strive to provide the highest quality of care for people that are coming here. And anytime you're giving folks an extra tool that allows them to do that better, I think it's exciting as a provider. So the feedback that I've had has been really, really positive.
And the feedback that I've gotten is also very positive. I think that everyone was very supportive of breastfeeding already. My coworkers have always been very supportive of the stuff that I do and have done with breastfeeding. But I think it also gives them more knowledge. A lot of times they're very surprised by the stuff that they learn. And I feel like all I do is talk about breastfeeding. But for the most part, everyone loves it. And they talk about how great it is and how much more they learn. And I learn myself too. So every time that I see a patient or anytime that I see someone who needs some help, sometimes I learn myself. So.
And I think along with that, I think as providers and nurses and other staff, I think we are all trying to learn how to better support our patients. So a big part of this grant has an educational piece too. So we've already held a training for our providers, and we're very grateful that one of our partners, which is Milkworks here in town, sent over Kathy Leeper, one of their lead physician, over to spend some time with our providers, educating them about how they can better support breastfeeding moms. And the next pieces are kind of building out some more education for our nursing staff so that they can assist Karina with some of the things she's doing. And then we are also training all of our staff just about the importance of breastfeeding. And so that grant has sort of enabled us to put some pieces in place so that we have the education we need to do a better job with what we're doing.
So let's say in a year from now, where would you love to be? What would be your dream for your organization?
Been working really hard to do more than just be a CLC. So I am trying to see what I have to do in order to become an IBCLC, which is an internationally board certified lactation consultant. And I think that would be a great goal to have and a great goal to achieve. But for now, I know that I am helping moms regardless. So that's very helpful. And I do speak Spanish, so that is one of the barriers that I'm helping with, especially patients that sometimes don't even know that there is access in that way, with the language barrier being one of the biggest barriers in their life. So today I'm actually giving a presentation in Spanish in the afternoon. So hopefully that helps a lot of moms gain some knowledge.
Wonderful.
And I think personally, my goal would also be to just have a good, solid foundation of systems in place to make sure that we are providing the resources that our patients want. And so we're working, part of the grant that's been useful for me is just to hear what some of the other bigger community health centers that have this grant in big cities are doing. And my hope is to kind of have even more handouts that are available in multiple languages, to have a process that we can connect them with Karina, to have other people trained within our organization that can also help her with that process. And then just being sure that no one feels unsupported if that's something that they're interested in doing. That's my long-term goal.
All right. So if maybe one of your patients is listening right now or watching this, where can they go if they have questions, or what would you suggest?
They're definitely welcome to come here to Health 360 if they have any questions about breastfeeding. If I can't fix those or I don't have the answers, I can always send them to the best resources that I have available. So they're definitely welcome here. And I know that some moms hesitate because they think things are silly or they shouldn't be going through this because it should be something simple, but it's not always that simple. And even if it is that simple, sometimes you just need a little push or someone to kind of give you, that information that you just need. So,
Any last words, guys?
We have such amazing partners here in Lincoln, both through partnership for Healthy Lincoln and Milkworks, that we were able to work together to write this grant. And I've just appreciated that partnership and then the opportunity through the funding to at least get the ball rolling and get those foundations set. And I'm just so grateful for everyone within Bluestem who's been working really hard to make this happen, and especially to Karina for all the work she's done.
Well, I appreciate you too, Dr. Peterson. I know that it's been fight for the finish, so we're getting there. And once our grant is over, it doesn't mean the project is over. It's just starting. So laying down the foundation sometimes can be the hardest piece, but I'm excited too.
Well, thank you guys both, and I'm really excited to hear how this keeps progressing, and maybe we'll check in a little while.
Yeah.
Thanks, guys.
Thank you for.
Hi, my name is Carl Dietrich, and I'm an environmental health specialist with the Lincoln Lancaster County Health Department. Having an above-ground swimming pool is a great way to beat the summer heat. However, there are some important things to remember prior to purchasing one. Here in Lincoln, we have a city code that says any pool capable of holding more than 18 inches of water must have at least a 4-foot fence around it. However, if you have an above-ground swimming pool with walls 4 feet or higher, then no fence is needed. This is because the 4-foot walls act as a barrier preventing any young children from entering the pool. For example, this pool would need a fence around it, while this pool would not need a fence around it. If a fence is needed, All gates and doors must be equipped with a self-closing and self-latching device. Finally, no matter what size above-ground swimming pool you have, you must take out and store any access ladders when not in use. If you have any questions regarding residential pool fencing, please contact the Lincoln Lancaster County Health Department at 402-441-8002. Help keep the kids in your neighborhood safe. Fence it. It's the law.
Hi, we're back at Matt Talbot Kitchen and Outreach, and I am here with Janet Buck. She is the nutrition coordinator, and we're going to learn about some of the nutrition services that are provided here. Hi, Janet.
Hi, Melissa, thank you.
So I have a feeling a lot of people probably don't know about you or all the amazing work that you do. Can you give us an idea of what's involved with your job? What sort of nutrition services are available for people at Matt Talbot?
Okay, yeah, sure. Well, one of the things that I do is I'm a licensed medical nutrition therapist. So that means that I am qualified to give nutrition counseling to people that have nutrition-related health issues. So things like if they have hypertension, heart disease, liver disease, kidney disease, want to do weight loss, eating disorders, food allergies. I'm available for a whole gamut of different nutrition-related health issues and have the qualifications to do that. So that's one thing that I do here, meet individually with folks for their therapy, their counseling. I also teach cooking classes. I have cooking classes for adults and for children. We call the Kids One Kids Cafe for children and food education. I have one series that runs during the school year and another one that we have during the summertime. And we do call it Kids Garden and Cafe because typically the children have come here and we go outside to our vegetable and herb garden and we have some fruit too. And take the kids around, have them harvest if there's things that can be harvested, and oftentimes I'll specifically have them harvest something that they can bring in and we'll do then for the food prep part of the class. So do that during the year, the growing season. And the same thing for the adult classes. I like to teach them how to cook or prepare foods that are seasonal, where the foods are seasonal, because of course they taste better and they're less expensive when you get foods that are in season. So we often take the adults out there too. And we have herbs, so we can go harvest our own herbs and use those in our cooking. So those things are probably what take up most of my time. Plus I sort of supervise the garden and making sure that we have some produce out there that we can use and checking to see what's ripe and ready to use at any given time. So those are really the things that take up most of my time. I do, newsletter articles. I post on Facebook too. If you're not on our Facebook site, that would be a great thing to look at. Not just for nutrition, but for all the services that we offer here.
Talk about some of the feedback that you get from the different people that you've been able to serve.
Well, from the adults in particular, I hear sometimes, because a lot of our folks that we have come here have had some problems in their lives, and a lot of times they've gone through maybe a treatment program and they're working on getting back on their own 2 feet. One gentleman told me this is the first thing, because I give them a little certificate at the end of the class, and he said, this is the first thing I've finished in years. He said, I don't remember how long since I've finished something, and he just seems so happy. They'll look at a meal that they've made, because we always try to make a complete meal with all 5 food groups, and they're just glowing. They're like, look what we did. People just feel so much, I think, self-pride in being able to do something like that, because a lot of times they haven't had a lot of success in their lives, and they just helped make a meal. So, and And I think it's also a very powerful tool to use to teach about nutrition, because a lot of times we'll have meals that are meatless. And, I don't make a point of that at all, but I've had people say to me, "You don't use a lot of meat in your meals, do you?" And I said, "Well, no, not necessarily." And even when we do have meat, we usually don't have it as a big, the main course. We'll have it incorporated into a stir fry or a casserole or something else that we're making, so that, again, because for the cost effectiveness and health reasons too. But so you can just make some very strong nutrition health points to people without lecturing at all about it or even mentioning it, and people sometimes pick up on that that's what you're doing. So it seems really powerful to me.
I know you mentioned the kiddos too. Why do you think, this early education with gardening and nutrition with kids is so important?
Oh, because so many reasons. I mean, I just think for health, teaching folks to eat food that's fresh as it comes from the earth, without lots of additives, preservatives, processing. A lot of children's, and adults too for that matter, their only exposure to potatoes is French fries or potato chips, but you can also have potatoes that you dig out of the ground and you get all of the nutrients that are there that nature's put in there. So I think learning that connection about where your food comes from and then learning how to prepare it in a healthful manner. So many times too, I think people think that if food's healthy, it doesn't taste good, and I want to dispel that myth totally, because fresh food is delicious if you prepare it in a tasty manner. So just knowing where their food comes from, how to prepare it. So many of our chronic diseases in this country and around the world actually are due to the way we eat and being overweight. So I just think, that all ties into being healthy and helping better the world in years to come. So,
are there any other things that our viewers should know about nutrition services, some of the work that you're doing?
Well, I do want to make sure that folks know that our meals are open to anyone. No questions asked. People can come eat here if they need to. And likewise, my services are also available for anyone in the community that would like to get more information about healthy eating, good nutrition. So yeah, they can come. And folks, I'm available for consultation too for our hunger relief teams, the teams that make our meals here. So people can come talk to me about planning healthy meals. And again, that's available to anyone in the community that would want more information about that. So
what you do is a key part of reinforcing the mission of Matt Talbot as well. So congratulations on everything you're doing and keep it up.
Thank you.
Shape of the City is dedicated to keeping Lincoln informed of health and wellness programs and events. Visit our calendar at lincoln.ne.gov, keyword Wellness Calendar. If you'd like to see your program or event covered, email us at LNKTV Health at lincoln.ne.gov.